Hello, I'm Bonnie Nasar, registered dietitian nutritionist, and we're going to be talking about mast cell disorders and the food minefield that presents with this condition. So we'll talk about the myriad of complicated dietary interventions and navigating your way to foods that you can enjoy. So first, let's begin with understanding the different types of mast cell diseases. And we're going to go through all of them, but we will not be going into detail. I just would like you to understand that there are many different types of mast cell diseases, actually. And it's important to understand this because you need to see a knowledgeable healthcare practitioner, an MD or a DO, who can diagnose you with the type of mast cell disease that you suspect you might have. There are actually different ways of managing some of them, and that's why it's really important to know this. So we'll start with mast cell activation syndrome. This is typically the one that most people are aware of. And then there's mastocytosis. So within mastocytosis, there are a whole bunch of different ones. We have cutaneous mastocytosis, that's on the skin. Indolent systemic, that's going to be a systemic disease. Again, smoldering systemic, also systemic disease. Systemic mastocytosis with associated hematologic neoplasm. Aggressive systemic mastocytosis, mast cell leukemia, and mast cell sarcoma. So what happens when you have a mast cell disease? What are the symptoms? There can be skin symptoms, and this is very common for most patients. You can get hives. You can have tabletop flushing, which is basically red skin that is hot and uncomfortable from about here where you are above a table, so your chest and your face. And then there can also be just generalized rashes that cause pruritus or itching of the skin, and that can be anywhere. There are gastrointestinal symptoms: stomach cramping, stomach pain, nausea, diarrhea, vomiting, reflux, heartburn. You can also get cardiovascular symptoms. This would include dizziness, heart palpitations, blood pressure issues. So it can be, for some people, high blood pressure, for some people, low blood pressure, syncope or passing out. You can have neurological symptoms. Brain fog is very commonly seen. Frequent headaches and or migraines, sleep disturbances, and executive functioning difficulties, meaning difficulty planning or doing tasks to completion. Orthopedic issues include osteopenia or osteoporosis, unexplained fractures, and arthralgia, which is bone pain. Constitutional symptoms include muscle weakness and fatigue, general malaise and myalgia, meaning having pain and just not feeling well. Excessive sweating can occur for people, particularly at night when the mast cells are a little bit too active. And one of the other predominant symptoms for a lot of people is anaphylaxis. And the definition of anaphylaxis is when two or more organ systems are involved. So that can be gastrointestinal symptoms plus skin symptoms. That can be cardiovascular symptoms plus gastrointestinal symptoms. Any two systems involved. It can be mild or it can be severe. It can vary from day to day or even week to week. There are a lot of factors that are involved in how severe anaphylaxis can be. The weather can be involved, stress levels of the person, their environment, chemical exposure, smells, and of course, foods eaten. So what are the diagnostic criteria for mast cell activation syndrome? Since this does seem to be the more common that we see in our patient population. Mast cell mediators release, okay? So what we need to see is that 2 or more organ systems are involved. So if you exhibit symptoms of mast cell mediator release with 2 or more organ involvement. Reduction and or elimination of symptoms when using medications that are traditionally used to treat mast cell disease. So antihistamines, leukotriene inhibitors, and mast cell stabilizing agents. And then we also need to see confirmed mast cell mediator increase via urine and or blood testing during acute symptom phases. So if you have what you believe is an acute mast cell reaction and you get urinalysis and blood work done to look at the mediators that were released, if there is an increase from baseline, this would be a criteria. So let's talk about mast cells and the GI tract. So mast cells that are going to affect the GI tract are going to affect nutrition. The mast cells in the gut are an important part of the GI system. They help to regulate the interactions between the GI tract and the rest of the body. So if a person has an increase in either the mast cell load, meaning the amount of mast cells, or the mast cell's ability to activate, meaning they activate a little too much or too quickly, this can lead to a lot of GI manifestations of symptoms. The mast cells are among the mucosa of the GI tract, and when they get activated, they can release pro-inflammatory mediators. And these pro-inflammatory mediators can compromise the mucosa, and that can influence a lot of stuff. Motility, your stomach's ability to move food along, visceral sensitivity, and the gut barrier function can be compromised. So here's a little mast cell letting out its mediators in the GI tract. So some of these mediators are histamine, heparin, chemokines, platelet activating factor, and leukotriene. So what happens when that little cell lets out these mediators? Well, a lot of different things. Symptoms can include abdominal pain, diarrhea and vomiting, bloating and gas, malabsorption of nutrients, esophagitis, and gastric ulcers. Not everyone is going to have the same symptoms. Some people might have some of these symptoms. You do not need to have all of these symptoms to have a mast cell disorder. How do we treat these symptoms? So traditionally, we use pharmaceuticals. We have mast cell stabilizing medications, proton pump inhibitors, histamine blockers, H1 and or H2, leukotriene inhibitors, and for some types of mast cell diseases, monoclonal antibodies. We can also make effective changes in nutrition and environment. How do we do this? Oftentimes utilizing an elimination diet. And that elimination diet can also include elimination of environmental triggers. The most common of these elimination diets are low FODMAP and low histamine, which we'll get into in detail. And again, when we utilize these changes, we like to utilize a detailed diary where we write down suspected triggers and symptoms that are noted so that we can look for patterns. Sometimes we will use supplements, and this is based on symptoms that a person is having, and as well as clinical findings, whether in the blood or urine. So what is the role of a registered dietitian in all of this? So oftentimes a physician will send us patients and we will try to help them with the nutrition-related aspects of mast cell disease. So typically we're going to help you with your gastrointestinal symptoms, your motility issues, constitutional symptoms if you're feeling unwell, any macronutrient or micronutrient deficiencies in your diet, and any drug and nutrient interactions if you're taking a drug and it does affect your absorption of certain nutrients. And then we will also address and be mindful of any physical limitations that a person might have. So for instance, if a person is unable to stand for long periods of time because they have POTS, we're not going to give you recipes to make that are 2 hours long. We're going to take that into account. We will assess your clinical nutrition picture to see what is going on, and we will prioritize your nutritional needs for you and set individualized overarching goals for your nutrition, and then break them down into smaller tasks that we can achieve success. So for instance, like an overarching goal is going to be, let's say, to reduce fatigue. And then how are we going to do that? Maybe we're going to set a goal of increasing certain foods containing certain nutrients so that a person can get maybe what they were missing and start to feel better. So usually we do weekly or bi-weekly check-ins to help you stay on task with the goals that we set. And then most importantly, we amend the goals as needed to help propel you forward towards that overarching goal of feeling better. Nutrition complications. So sometimes patients come to us and they have a lot of difficulty in managing their nutrition because there's a lot going on. Sometimes people have a feeding tube. Sometimes they have very few safe foods to eat and are unable to add back foods. A patient could have recurrent anaphylaxis, which is preventing them from trying new foods because they're not really sure what's causing the anaphylaxis. Environmental triggers, sometimes we can remove them, sometimes we can't. Questionable diagnosis, meaning a person hasn't gotten a firm diagnosis and don't really know what's going on and aren't really sure. Having comorbidities, meaning other diseases or diagnoses that can complicate things. Disordered eating, having food disorders, and also having what we call food PTSD, being afraid to eat food. So if a person has very few safe foods, we have to look at what factors are contributing so that we can begin to assess and start making goals to help that person include more foods. So was there an elimination diet without any reintroduction? So it's very important that if a person is going to eliminate foods, we do have to be very methodic about it and include the reintroduction phase of that diet. We don't do elimination diets without reintroduction. Sometimes, for some patients, the act of eating in and of itself can cause a reaction, and this has to be looked at. Usually we would refer back to the physician with that case. Mental health diagnosis. Are there mental health issues that are also complicating things? Comorbidities, celiac disease, Crohn's disease. You know, when we have competing diagnoses, sometimes we have an issue reintroducing foods for other reasons. Is there a disordered eating diagnosis? Is there a fear of certain foods or certain food groups? Are there sensory issues where there's a fear of certain textures or certain colors of food even can occur? Food PTSD due to having had food reactions and or anaphylaxis in the past. Sometimes that can make it difficult for a person to reintroduce foods. So if a person has done an elimination diet without reintroduction, what can you do? Work with a healthcare professional, a registered dietitian or a registered nutritionist to slowly reintroduce foods into your diet in the right way. Food reintroduction must be done slowly and methodically for optimal results. And using a food and a symptom diary is essential for this. If the act of eating causes a person a reaction, we need to work with the MD or the DO that is a mast cell disorder specialist. Sometimes a reevaluation of medications with your expert healthcare professional is important to do to see if we can get a better cocktail of medications just to calm those mast cells that are reacting just by literally eating. It's important to look at everything: living conditions, your HVAC, soaps, laundry, dish detergents, diet, stress level, work environment. Leave no stone unturned to look at why a person's mast cells are just primed to go off. Sometimes it can be environment, sometimes it can be actually the act of eating. Sometimes that can be because of the food temperature or the way it was prepared or the preservatives in the food, even sometimes the food containers. So we have to really, really delve deep into looking at why the act of eating would cause a person a reaction. Sometimes it could be just the stress of thinking about trying a new food. So we need to really work with a person to make sure that we are looking at every aspect to help them get to a better place with food and with eating. So the comorbid diagnoses, so these types of things can be a history of an eating disorder. Sometimes that can complicate a person's ability to try new foods. Mental health disorders can complicate things as well in terms of trying new foods if there's an anxiety level there. And we need to work with, in collaboration with, mental health providers to help the patient overcome this. Autoimmune diseases can also cause issues and complicate things. And, any other conditions that can impact food intake, such as even like having like a lactose intolerance. And we need to work with that. IgE food allergies can also complicate things. And, with IgE food allergies, we do not reintroduce those foods. We defer to an allergist to decide how allergic a patient is to a food. So the fear of eating because of a past experience. This is sometimes referred to as food PTSD. This is a very, very real and complex phenomenon, and it can limit diet immensely. And with this diet limitation, it can contribute to feeling unwell because you're not eating enough and you're not getting enough nutrients. And this can really wreak havoc on the body. So how do we deal with food PTSD? It's very important to have a very knowledgeable healthcare practitioner who is willing to collaborate with your other healthcare practitioners. Oftentimes we find that biofeedback can be very helpful. And, in working with these patients often, we have tricks up our sleeve. We can help you overcome this. It is very real, but it needs to be overcome. So let's talk about food elimination and reintroduction diets. So oftentimes in the mast cell disorder people, we look at reducing or eliminating high histamine containing foods such as pineapple, tomatoes, MSG, fermented foods, alcohol, and chocolate. These are the most common of the high histamine foods. Sometimes for some people, it's going to be removal of the nightshade vegetables, especially if they also have an autoimmune disease as well. Things like eggplants, tomatoes, peppers, potatoes, and sometimes it's going to be food dyes and artificial sweeteners, preservatives, or any ingredient that your grandmother may not recognize on a food label. Spicy foods can also be something that people commonly will eliminate. And just any food at all that you think is causing you a reaction. It's very important for us to listen to our patients and, whatever they suspect might be causing them an issue, that is something that we might want to eliminate. It is very important to understand that, generally speaking, if a food does not cause any symptoms in a patient, we do not recommend that you eliminate it. Even if someone took a poll and they decided that 90% of mast cell disease patients have an issue with tomatoes, if you have eaten tomatoes and you feel fine with tomatoes, you do not need to eliminate those tomatoes. So what food can cause symptoms in one person is not necessarily going to cause symptoms in another person. So unless a medical professional has a good reason to tell you to eliminate a food completely and not reintroduce it, there's no reason to do that. So obviously we know how to eliminate a food, right? We don't eat it. Now, how do you reintroduce that food, right? So I like to use a 3-day rule. Day 1, we start out with a teeny tiny amount on the first day, just a bite or 2 at one meal only. And we look for a reaction. So we note the time that you eat something and the time that, you had any sort of symptom. And if there's no symptom that day, the next day you can increase it to a few bites. We only do 1 new item per day for a minimum of 3 days, because unlike an IgE allergy where a reaction is typically immediate, sometimes the reaction is not immediate with a mast cell reaction. There can also be setbacks. So something else could be going on in your life that day or those 3 days where something else can occur. So sometimes it's longer. So if a person accidentally did eat a food that is known to be a trigger while they're in the middle of trialing another food, we're going to have to put that on the back burner and wait till they're feeling better and then try to reintroduce the food. So it's very, very important to utilize recording of time and type of foods eaten and the symptoms and the duration, of the symptoms for the elimination and reintroduction diet. It cannot be done without this. This can be done, with a traditional pen and paper in a notebook, or it can be done using an app. So a lot of times people will talk about the low FODMAP diet, and this is an elimination and reintroduction diet. It is shown to be effective in patients who have irritable bowel syndrome. So what is a low FODMAP diet? So the FODMAPs are fermentable sugars, oligosaccharides, disaccharides, monosaccharides, and polysaccharides. So these are just different types of carbohydrates that can cause gastrointestinal symptoms. So we eliminate these specific types of carbohydrates or these groups of carbohydrates, and we eliminate them for somewhere between 2 and 6 weeks. And then after that period of time, we reintroduce each group one at a time to, again, look for any symptoms that occur when it gets reintroduced. So sometimes people with irritable bowel can feel significant relief with the elimination and reintroduction and figuring out which specifically are the culprit for them. But some foods containing FODMAPs have actually been shown to be helpful to the gut microbiota, and specifically even to helping calm mast cells. So it's not always indicated for every patient to do this. And also, these foods are meant to be reintroduced and hopefully tolerated. So short-chain fatty acids, which are important in the gut, they may lower inflammation and prevent degranulation of mast cells, so particularly the butyrate. But if we eliminate FODMAPs, sometimes we're going to eliminate that butyrate in the gut, and we don't want to do that always. So, it's important to remember that if too many foods are eliminated for too long, nutrient deficiencies can occur, and this can lead to changes in the gut microbiota that might not be ideal for symptom management. The low histamine diet is the other typical elimination diet that we hear about, and this is avoiding foods high in naturally occurring histamine, which is an amino acid that will attach to mast cells and cause them to degranulate. So many people, when they talk about the low histamine diet, they're referring to the Swiss Interest Group Histamine Intolerance List, okay, otherwise known as the SIGI list. And it is a complicated rating of foods in terms of histamine content, histamine liberator, and histamine blocker. And they just have this list that you can download from their website. But one thing to note is that directly on their website, they list references as scientific, Nothing specific, but they say it's scientific, but they also say that it is based on books, blogs, and patient experience. So no detailed or specific references are given as to where this information or the numbers that they got for these specific foods have come from. So it is important to understand that. So what is the elimination in the low histamine diet? So we're eliminating alcohol, we're eliminating fermented foods, we're eliminating certain types of meat, especially the processed meats, and then, certain types of fish, certain types of fermented dairies, and, any dairy that's been aged, certain fruits, food additives and food dyes, certain types of vegetables, and seasonings. And these items are all eliminated. But again, if you look at this list, if a person eliminates all the foods on this list, they're not going to have that much to eat. So it is important to understand that the SIGI list is a jumping off point, but by no means should every person with a diagnosis of mast cell disorder go and completely eliminate all those foods always and forever. So how do you modify your diet? There are apps that you can use for keeping a food and symptom diary. You can also use a simple pen and paper. Because this is a complex thing of elimination and reintroduction, it would likely be helpful to get a referral to a knowledgeable registered dietitian or registered nutrition who has significant experience with mast cell disorders. If all of this feels overwhelming and you cannot find a practitioner who has knowledge in mast cell disorders, a great place to start would be, and I know not everyone here listening is an American, but is to move away from the standard American diet, the SAD diet, and move away from less processed foods, going towards more whole foods based way of eating. So less foods in a package, more foods fresh from nature is a good place to start. It's important to stress the inclusion of a variety of foods to optimize your nutrition. We need to have a variety of foods in our diets in order to feel good. It's also really important to know and to work with your limitations, your cooking skills, your physical abilities, even your motivation level, because you might have symptoms from your diagnosis that kind of make things difficult for you. So again, if you can't stand for 2 hours because you have POTS, you should not be making a recipe that takes 2 hours to complete. Let's talk a little bit briefly, because this is often a difficult thing for mast cell patients. How do I eat in a restaurant? So it can be tricky, but it can be done. It's important to call ahead at a time when the restaurant is not busy. You do not want to ask during crunch time at dinner at your table when your server is just trying to get the orders in and get to the next table. That's not the time to ask them, oh, what is this made with? What is that made with? And have them have to go back to the cook or the chef in the back and ask them questions while they're crazy busy. You want to call the restaurant in between meals, not during a meal, and you want to ask to speak with the head cook or chef. And then you want to ask your questions in an easy way where they're not busy and they actually have the time to answer. You'd much rather ask the chef or the head cook than the server. The thing that you would want to ask the hostess about would be what scents or soaps are used in the bathrooms or cleaning agents, if that's something that's going to negatively impact you. And maybe you're just going to bring your own soap to use instead. If you do have a history of anaphylaxis, it is very important to let your server know that you are at risk so that your requests are taken very, very seriously. And if possible, it's always best to choose a more whole foods-based restaurant, so more farm to table, where they're using less foods out of a box and a bottle, and you're going to eliminate the issues that you might have with food preservatives and additives. Thank you so much for listening. I hope you enjoyed.